umuwi na ako dito sa Philippines. Dito ako active, ano ka ba? Ako ang COVID doctor ninyo.
Hi, I'm Dr. Jose Eduardo Duya. I am a board-certified internal medicine specialist and a board-certified adult cardiologist. In short, I am a doctor who earns a living out of healing broken hearts. I took up my training at the University of the Philippines, Manila, where I took up Bachelor of Science in Public Health, and then after that, I pursued Doctor of Medicine at the Philippine General Hospital, the UP College of Medicine. I took my internal medicine training after that, for 3 years. By the way, I was a straight internal medicine intern when I was an internship. And after that, I proceeded with the internal medicine program for 3 years, where I graduated as the most outstanding resident for 3 consecutive years. After that, I proceeded to fellowship in cardiology at the University of the Philippines, Department of Internal Medicine, section of cardiology, where I happened to be the chief fellow, and I won most outstanding fellow in cardiology in 2017 of the Philippine Heart Association. So in 2020, I decided to finally settle here in Pampanga, because as they say, home is where your heart is. So therefore, I'm a doctor of the heart. So I decided to stay here in Pampanga, and have established my private practice. Right now, I'm practicing in Magalang, Pampanga. I have a clinic in Dao, and I have a clinic also in Angeles as well as in Clark. As a child, I saw the need for a specialist in our locality. I came all the way from Magalang, Pampanga. So in our small hometown in Magalang, where I came from, during that time, there are a few internal medicine specialists. These are doctors who specialize on adult medicine, So mga doktor na mga lolo, lola, na mga nanay, tatay, I was so inspired then by a sole cardiologist in our locality. And I was amazed, I usually accompany my mama and my lolo, lola, to the doctor. You have to wait to line for hours, just to see the doctor. Ganun ka-konti yung doktor at ganun kadami yung pasyente. So, I really wanted to be a doctor as a child because I was so inspired by Jose Rizal. Kasi Jose Rizal was the first book I read, yung Kwentong Bayad tungkol kay Rizal. And when I was little, I was elementary, I was gifted by a book by my neighbor who happens to be a librarian. I learned that Jose Rizal is a doctor and also an author, and also I became a hero. So he was being my life peg. So that's why I studied at the University of the Philippines, because I wanted to do that. Why internal medicine? Because I realized after graduating in public health, I realized that most of the diseases of the elderly are hypertension, heart attack, stroke, pulmonary tuberculosis, pneumonia, and I will be of great benefit to my community if I become an internal medicine specialist. With your question, how did I decided to pursue cardiology? Diseases of the heart has always been something that fascinated me. So I think for that couple of decades, or even for so many decades, the number one killer in the Philippines and in the world is heart attack. And I believe that in the next few years, it will continue to be the number one killer. So to be relevant to the society, to be relevant to the community, as well as to be a bread and butter for a doctor, I believe that that's something that we need to join the force, to the healthcare force, in order to bring down the mortality as well as the disability that this chronic debilitating diseases can actually give. So it's very difficult to introduce internal medicine to a lay person. Usually, hindi nila naiintindihan kung ano ba yung internal medicine. Kasi sabi ko, doktor po kami ng bopis, kat-atay, balon-balunan, puso, baga, that's just a joke, But an internal medicine doctor is someone who primarily specialized in treating adult diseases, all internal organs. However, in cardiology, it's another 3 years of clinical experience, as well as research experience, specializing on a specific organ of interest. In my case, it's the heart, So I'm a doctor who specializes in treating diseases of the heart attack, heart failure, paghina ng puso, pagpalya ng puso, irregular na tibok sa puso, pagbagsak ng blood pressure, even in the ICU when I further train, paggagamot sa mga pasyenteng nag-aagaw buhay, no? Or yung naghihingalo, no? So that was my specialty. There is a false notion that you should only see a cardiologist when you have a heart problem, no? Sa totoong buhay, hindi kami pinupuntahan ng tao kapag wala silang simptomas. They usually go to a general doctor, they usually go to somewhere else, no? They usually get referred to us kapag sila ay sumasakit ng dibdib, no? Sila ay nagpapalpitate, no? Hindi na sila makontrol ng mga doktor nila. And then we come in late. I think the general advice, no? Cardiologists are your friends, no? Hindi kami yung tipo ng person na pupuntahan mo lang pag nag-aagaw buhay ka na. I think there should be a shift in the mindset of Filipinos, no? Ganun kasi yung culture natin bilang Filipino, no? We do not give priority to health in general, no? Parang it's the last thing that you save your money for. Kung meron kang money, bagong sweldo ka, wala sa pagkain, pag-enjoy ng luxury, punta ng mall, magpariban ng buhok, magpakulay ng buhok, no? Mag-gym, no? Yung pay particular attention at kalusugan, hindi natin siya laging binibigyan ng priority. So I encourage everyone, no, to visit your cardiologist at least once a year, particularly if you're of age already. No, anyone more than 40 years old should see a cardiologist at least once a year. So you identify your risk of developing a heart problem later on. No, hindi lang cardiologists, also other doctors in general. So I think that's the advice I want. No. There are about 1,600 cardiologists in the Philippines. No, a lot of the cardiologists are leaving the country because in the Philippines we are not paid as much as the doctors or the professionals abroad are doing. Kala nila ang cardiologist nag-oopera sa puso. Kaya pag pumupunta sila sa amin, ayaw nilang pumunta sa cardiologist kasi iniisip nila pag pumunta ka sa cardiologist, mauoperahan ka sa puso. That is a misconception. Clinical cardiology is the branch of cardiology that treats patient, treats the diseases of the heart in general, That's one misconception. Number 2, naisip nila na ang cardiologist napakamahal sumingil, Yun ang lagi nilang reason ba't hindi sila pumupunta. They will opt to go several times, maghahanap sila ng doktor na tingin nila abot kaya, Because as we all know, very limited yung cardiologists sa mga government hospitals. Most of the cardiologists are really private practitioners, Meaning to say, we have our own clinics kasi nga, the government also does not have an item, for cardiologists like us, You have to understand that to become a cardiologist is different from becoming a general doctor. Kasi to become a general doctor, from high school, you need to study for about 10 years. Then you become a general doctor. But to become a cardiologist, you need to study 3 years of internal medicine and another 3 years of cardiology. So practically 16 years plus several more years, if you want to become a more subspecialized type of cardiologist. So if you're going to a kapitbahay mo na nag-advise sa'yo na uminom ka ng aspirin versus sa someone na nag-aral, nag-train for 17 years, you'll get different quality of advice. So I think it's very important to trust the specialists, to trust the board certified ones because we really dedicated practically half of our life. So when we entered into medicine, we were 18 years old. When we finished, we are practically 36 years old. So practically half of our time, nasa pag-aaral kami para gamutin yung mga puso ninyo. So hindi mahal kasi if you want to get quality care, you have to trust the experts.